And it's time now for a health report. And joining us now is Africa 54 health correspondent Linord Moudou with the latest news on cholera. Hello, Linord.
Hello, Esther. The World Health Organization is responding to multiple cholera outbreaks that could flare up and threaten the health of more people if control measures are not intensified. More than 10,700 cholera cases and almost 200 deaths have been reported in 5 countries in the Eastern Mediterranean and African regions: Iraq, Bahrain, Kuwait, Democratic Republic of Congo, and Tanzania.
Most cases of cholera actually are not symptomatic. People get infected and don't show symptoms. So they could travel with the Vibrio because they are just infected. The difference is that if you get cholera, let's say like here in Switzerland, it's not going to spread further because the water that we use for drinking is clearly separated from the sewage system.
Spread of cholera is a major concern if control measures are not taken urgently. The cholera situation in the African region is especially worrisome.
Our concern for Tanzania and Eastern Africa in general is the forecast, the weather forecast of a very bad El Nino season. And the last time we had this, it was in 97, 98 in that region, and we had 200,000 cases, 8,000 deaths just in 4 countries of the region.
Iraq's health ministry says the country is carrying out a major vaccination campaign to combat the outbreak that has infected more than 2,200 people. The campaign focuses on vaccinating people displaced by conflict. In all affected countries, WHO and health partners are supporting the ministries of health to treat and prevent the further spread of the disease. Patients are being treated with oral rehydration salts, infusions, and antibiotics.
You will have 40–50% risk of death if you don't rehydrate patients. That's the key to the treatment. And with good treatment, we observe less than 1% of patients dying. Still high number because we have a lot of cases, but it's much better than if you don't treat them. Then the second very important action to put in place as soon as possible is to provide people with safe water.
Increased surveillance at the community level for case finding, provision of safe drinking water, improving sanitation are some interventions to control the outbreak. In addition, widespread communication campaigns are ongoing to encourage families to purify water, prepare food carefully, and wash their hands. Cholera is an acute intestinal infection caused by ingestion of food or water contaminated with the bacterium Vibrio cholerae. It has a short incubation period and quickly leads to severe dehydration and death if treatment is not promptly given. Joining us now live via Skype from Olympia, Washington, is David Albert, board chairman of Friendly Water for the World. It's an organization working to expand global access to low-cost clean water technologies and information about health and sanitation. Mr. Albert, welcome to the show.
Well, thank you.
Your organization has been actually working on the ground. Can you give us an assessment of the situation in Africa?
Well, we have seen cholera outbreaks in at least 4 countries. The biggest outbreak by far is in the northeastern part of the Congo, where since January there have been perhaps 100,000 cases and 2,000 deaths. We have been working specifically in the 26 orphanages in Goma, where we found since January there had been more than 700 cases and 67 deaths. But we were able to wipe out every single case of cholera in the 26 orphanages.
But presently, the outbreak is still expanding. Is this correct? Or has it been contained?
We receive new reports almost daily. There's been an outbreak in the Masai Mara region of Tanzania. We have seen some cases in Western Kenya as well, and we've gotten reports of cases in Ghana.
So what is happening, really? What is the problem there? Why is it still spreading if the WHO and other organizations such as yours are involved in trying to contain it?
The difficulty is simply the lack of clean water, especially before the rainy season. Cholera concentrates in the shallow water that people are using for drinking, cannot purify their water. These are areas that don't have access to clean water systems. What we do is teach people to build themselves, to build biosand water filters, a very simple technology that can remove virtually all Vibrio cholera from the water supply.
So is there some type of anticipation as to when this could be contained?
Actually, I don't know. Again, we don't work specifically with governments, but with local people on the ground who are working to wipe out all cases of cholera themselves.
And how can government contribute to this and make your work easier?
Well, first of all, government needs to make clear to their citizens what's actually causing the outbreak. Good sanitation and hygiene could make a very big difference. Building of latrines in public places could help greatly. And making sure that the sources of water aren't contaminated. Cleaning water is fine, but if you can get to the source of infection, people are better off.
And quickly, the way forwards in terms of working in the DRC for your organization, quickly.
Yes, well, we have a medical officer based in Goma. We're working all over the Northeast, North and South Kivu provinces. We are training people to build their own biosand water filters. People, if they have the knowledge and the skills, really can deal with this themselves.
Okay, thank you so much, Mr. Albert. And that was David Albert. He is board chairman of Friendly Water for the World. And that's our Africa Health Report for today. Back to you, Esther.
Thank you, Linord. Be sure to watch Linord Moudou's health reports every Tuesday and Thursday right here on Africa 54.